Yes.
Okay, awesome. So I'm really excited to talk about this topic because I know that we work with a lot of women, especially perimenopause, menopause women. And I think in the health space right now, a couple of the like big topics are like hormones and Ozempic for for whatever reason. These are like really hot topics. And some of the research has been updated quite a bit around hormones. And so more and more doctors and patients are looking to this solution. And I think it's, obviously it's an important part of our health. And if there are safe ways to use this tool, then, everyone should know about that. So I'm ready to start going over all of the different things to consider. Now, one of the first things I think that's kind of like the first thing to talk about with a client who's interested in hormone therapy is what is the driving factor behind that? Is it that you are experiencing menopause symptoms? Are you interested in like the health benefits, or are you concerned with, what I often hear is women are experiencing menopause challenges, but they're scared to use hormones. That's probably the most common, um, issue going on, is that they're scared of them. The other flip side of it is where they're maybe using it to band-aid symptoms and not really thinking about their health in the bigger concept of things. So that's my first question for clients is like, what is the reason for your desire to get on hormone therapy? Because sometimes women are assuming that their issues are hormone related when maybe they're not. So, and part of the issue too, I think, comes from healthcare providers who are doing bioidentical hormones. It can kind of come across as if they're saying that everything is hormone related. Like it comes across a little salesy sometimes when I see people posting about their health issues, and I'll see a provider being like, "Oh, you need to be on hormones. Oh, you need, pellet therapy. You need hormones. Come in for hormone testing." And they're kind of, in my opinion, it feels like they're pushing hormones everywhere, and not even like assessing the person first. So for me, I feel like no, we need to do more homework before we just assume that whatever you're experiencing is truly hormone deficiency or hormone imbalance. Now, that can certainly be going on, but a lot of times hormones are the result of a different issue going on. Now, menopause is kind of its own separate category in this for this area of topic because there are truly major hormone shifts that happen that can't necessarily be easily, fixed with other areas of your lifestyle. So that's the one caveat in that point. Um, so as far as the different types of hormones, I think this is really important. Some people, they're told to get on an estrogen patch or, different hormones, and they don't realize the difference between the different types, and that's so key. So when we're looking at synthetic hormones, um, there's a lot of different types, and women don't even think about birth control as hormones. So I just wanted to mention that in this example because there are progestins, there's synthetic hormones and a lot of different birth control options. And sadly, that has some pretty big health repercussions. And that's a whole other topic in my opinion, because it takes a lot more time to explain all the ins and outs of that. But I did want to briefly mention that so that women are thinking, oh yeah, I guess that technically that is hormone therapy. But the other ones, Provera, Prempro, those are really common. And I'll get into more details on like the pros and cons of each of these types. But bioidentical to me is like these two over here, in my opinion, the only options. Like I would never consider this like I'd rather just go without. And you guys will understand that probably in just a second. So, synthetic hormones, they're made from horse urine during the horse's pregnancy. They're not bioidentical. They are similar and they bind to the receptor sites and they have a biological impact, but it's not necessarily without negative side effects and concerns. So, like most prescription drugs, there's side effects and concerns, and even with bioidentical hormones, there's things to look out for. But these are, in my opinion, not worth the risk. There's increased risk of blood clots, breast cancer, affect your bone density in a negative way. So, when women hear all the health benefits of hormones and how it helps your bone density, well, not necessarily. Depends on what kind of hormones you're taking. It increases UTI risk and it negatively impacts your memory. And progestins in particular, which a lot of people will just call these progesterone. They're not progesterone, they're progestins, and it has a different impact. And some of them have an androgenic effect like testosterone and can cause hair loss. So to me, these are, and I personally have, met women who've gotten breast cancer because they were on a synthetic hormone, or I I had a patient who was coming in for thermography scans and her scans looked totally normal for a long time. She was really, really high risk for breast cancer with her family history, and she had a lot of density and stuff going on. And her OB-GYN, she was telling her about some menopause symptoms like vaginal dryness or something, and her OB-GYN was like, here's an estrogen patch. Didn't do any blood work, didn't consider her health risks and, history, and just put her on estrogen blindly. Now, you'll learn by the end of this talk why that's such a problem. But thank God she came in for her thermography scan. Both breasts became much more inflamed and active, and that was very odd for me to see. And we were concerned about that. And thankfully, she didn't have breast cancer, but she had like this big health change happening that we could see on her scan. So I talked to her about that and said, this might be, and she didn't tell me about the hormone patch. She said nothing had changed. She wasn't on any prescriptions. And I was like, what the heck's causing this? So we started talking and I mentioned hormones. She goes, oh, I forgot I'm on an estrogen patch. I go, girl, please go check your hormones, because she never got tested and ended up having really high levels of estrogen and like quickly got off of it, and her scans like kind of got back to normal. But to me that was like, wow, if she had, because she went and had a 3D mammogram, it was all clear, didn't have breast cancer. But I liked how on the thermography we could see that there was an unhealthy change happening in that direction. And so grateful that she got out of that mess, because I have met women who were on too much estrogen and ended up developing breast cancer. So definitely something to be aware of. And the blood clots and breast cancer, this goes for hormonal birth controls as well. So young women also need to be knowing about these issues. Bioidentical hormones, these are extracted from plants, but they are not plants. They're not plant compounds. They're actually altered to match our natural hormones. And so I'm going to talk on the next slide a little bit. I'm jumping ahead a little bit with the non-hormonal options, because some people think like wild yam cream is just yam cream. And it's actually like they extracted that from the plant and matched it to progesterone molecules. So, it's funny. I feel like some people are like scared to do bioidentical hormones because they don't feel that it's natural, and they feel like the wild yam cream is natural. But it would be weird if like our hormones could be replaced by yam, right? So like it and to me it's almost like a misconception, because bioidentical hormones means that they're identical to our natural hormones. So it's like a key fitting in the lock. And if you try to use something natural like blueberry or yam or something that is a different thing, like obviously that's not natural either. Even though it's a plant, it's not natural to our hormones. So this to me is like that's bioidentical. That's almost like, you know, like when a diabetic needs insulin, give them insulin. Like it's identical. So with the pros with this is that it is actually almost like the opposite of the last slide with the synthetic hormones. It can be protective, and I say can be because the caveat is, it being used correctly, monitored, and safely, and the person is having healthy pathways, which we're going to get into. So that's why I'm saying can be protective. It's not automatically, in my opinion, automatically fixing all these things. It depends on the context. And if someone's giving you bioidentical hormones at really high levels, like even if you are a young woman or any age, you have really high estrogen naturally, well, that's not healthy. So same thing with bioidentical hormones. If you're getting too much of a good thing, that can be an issue. So can be helpful with these things if done correctly. It does reduce all-cause mortality by like 19%. This is significant health benefits if done the right way. It can help with glucose regulation, definitely helps with bone density, mood, memory, muscle retention. So this can help keep your metabolism healthy, keep your weight healthy, keep your skeletal muscles protected. So as we age, fractures and things like that, all of this is kind of synergistically helpful together. Now, the cons is that it's not covered by insurance. It can be expensive. It's not FDA regulated. Now, some people think that's like, maybe a pro or a con, depending on who you ask. But, that's some of the reasons why doctors don't necessarily, like your regular, typical doctors not doing bioidentical hormones or offering that as an option. Now, non-hormonal options, that would be like herbs. I don't consider wild yam cream non-hormonal because again, it is altered to be like a progesterone. So I don't have that listed here, and that's a little bit confusing for people, but that's just the truth. And then, so the pros is that it's less controversial, it's less scary for people, it has a weak impact, which can be a pro or a con. But essentially, the reason why I put it as a pro is that, it's kind of like dipping your toes in the water, so to speak, and like gently seeing how you respond. The may be enough to help reduce symptoms. Now, whether or not it's enough to give you some of the health benefits, some of the protective benefits, and like the bone density and all of this, I have not seen research to prove anything with these tools, these herbs, to be strong enough to have that outcome. I don't suspect that, to be honest, because it is definitely a lower impact on your hormone balance. But for symptom reduction, it can be enough for some people. It's inexpensive, easy to access. So those are the pros. The cons might not be strong enough. When you have gone into menopause and your progesterone isn't being produced by your ovaries anymore, there's not really any natural or alternative way around that. So, and I do want to also mention this isn't just in menopause. So sometimes women are still having their periods, but they're not actually ovulating. And that would be something that you don't necessarily feel. You would have to know via testing, unfortunately, to know whether or not you're actually producing healthy levels of progesterone. Unfortunately, I've seen a lot of young women these days where they're so stressed, they're depleted, they're already in perimenopause hormone levels in their 20s and 30s. And that really concerns me because if that's not fixed, then over the years, they're not getting that protection from progesterone. They're more likely to have some diseases and issues going on. And then also their bone health is affected by that. So some women, they'll tell me like, oh, I would love to go into menopause in my 40s. Like, let's just get it over with and me not have to have a period anymore. But the downside is that you're weakening your bones every time you're not, having a healthy cycle leading up to menopause. So we want to have healthy cycles. We don't want to have low hormones early in life. So if you are not sure if you're, have healthy hormones, I think women in their, 20s or 30s, it's not, irresponsible for them to include some hormone testing in their regular, health workup because we want to make sure that you're getting all the benefits from balanced hormones that should be there. Another con would be like that there's not really a lot of research on like the perfect dose for these things. It's a little bit more of like trial and error. I would say that's true for really any kind of hormone therapy, though. There is a little bit of trial and error. I recommend always starting with like lower dosing and working up whatever tool you're using, whether it's hormonal or non-hormonal. But it does take time to kind of dial it in per person. It's very bio-individual. And of course, this isn't covered by insurance either. So different delivery forms matter as well. So not just whether it's synthetic or bioidentical, but let's say you choose bioidentical and the provider is like, we're going to do oral pills or we're going to do a patch or whatever. I would just encourage everyone watching this to look into the pros and cons of whatever your doctor's suggesting for you before you start using it, because I think it's important for people to know what they're dabbling in when it comes to hormones. Hormones have big impacts on your body. So this is something you want to be educated on and informed before you just willy-nilly start using hormones. But I will say oral pills, progesterone and DHEA are pretty safe to take orally. It can cause some drowsiness with progesterone, so that's why a lot of times they'll tell you to take it before bedtime to help with sleep. And for estrogen, this is a concern. Like, I would not take estrogen orally because it can cause issues, bioidentical or not. So, because it's going through your GI, your liver, it's causing a big dose through your liver. Your liver's not used to having to deal with that, so it's not great for that. And there's other delivery methods with estrogen that are totally fine. Sublingual melts are like troches and tablets that melt. They're kind of, not as enjoyable for people because they're just sitting in their mouth slowly dissolving. They might not like the taste. It's a little easy to adjust the dose, but you're still swallowing a lot, and it's kind of the same concern with that. So not ideal. And then the creams and gels, I would say this has by far the safest profile through the research and data. A low dose topical transdermal is going to be a really good option in my opinion. It goes into the bloodstream. It's not going through your liver, your GI. It's really easy to adjust. Like if you're using cream, you can use a little more, you can use a little less. Like it's very easy to adjust if you're sensitive to something or you start feeling some kind of reaction, you can stop using it right away. Gel is released a little bit slower, so that can be nice for just a little bit more level hormone throughout the day. I don't think they have a progesterone gel. I think it's just estrogen gel. So sometimes it's annoying just from a practical standpoint of like having to use all these different types. Creams, you can have compounded like estrogen and progesterone and kind of like do a blend, whereas, a lot of these things have to be like individual and you're doing multiple things and can be a lot to keep up with for some people who are really busy. One of the downsides is that topicals can be transferred. So you want to be smart about like putting it on and coming in contact with your spouse or your partner. The other thing is like if you put it on and then you take a shower or you go swimming or something, you want to allow time for it to be absorbed. So things like that you want to think about. It does have to be applied daily, sometimes twice daily. And some people aren't good about doing things routinely like that. And I just put a little note here. You do want to monitor with saliva because it's low levels and it can be hard to pick up in the serum testing or urine testing. And so I think a lot of times people will also maybe do some hormones on their own. Like you can get wild yam cream, right, from Amazon or wherever, and you may not realize like how to monitor your levels and that different delivery types of hormones may or may not show up on different types of tests for hormone testing. So again, talking with someone who knows these types of things and what type of tests to do for you when you're on certain types of hormones, like it's a little more complex and important to monitor the right way. So the patches, another transdermal option. So again, it's kind of safe like the cream. The downside to me is that, you know, you have to apply it every few days. It's set doses, so it's not like you can lower the amount or increase the amount very easily. It's set in the patch. It doesn't transfer though to partners, so that's nice. And I believe it's only estrogen patches available. I tried to see if there was testosterone patch. I know there's not progesterone. Um, so this would be like you could have an estrogen patch, but then you still need to do progesterone orally or cream or, you know, starting to get multiple products going on. Injections, again, you know, it's bypassing the GI, so that's good. You want to do them like weekly or bi-weekly. So you don't have to do it every single day, but a lot of people don't like injections or needles. The other thing is like some people may not be the best for doing it safely. Knowing how to do it, knowing to aspirate before you inject and, you know, so it's not going to a vein, it's going into the muscle, those types of things. So there's some issues around that. Um, but it's also a little bit more of a consistent dose throughout the week compared to pellets. Pellets have like this spike in the hormone level and then they kind of like drop down over time. So the pellets are probably your most convenient because they last so long, but and I would say that they're somewhat safe. It just depends on the person. I mean, all of this kind of depends on the person and how they're processing the hormones, and we'll get into that. But the pellets, the main thing that really concerns me is when people try this first, because God forbid you have a reaction. I've just heard horror stories with some of my clients where they just feel horrible and they're stuck with it for months. And I don't want anyone to have to go through that. So I always say if you're going to try hormones, try other forms before and see how you do on that before you even think about doing a pellet. You don't have progesterone pellets. So again, this is just kind of like one option. Can be a bit more expensive. And I don't know if Ashley, you want to jump in with any of your thoughts on different types.
Um, I mean, I think the same way about all of it, honestly. I think for me, my biggest thing that I always tell people is ask why. Why are the hormones low to begin with? Because
Mm-hmm.
like I've seen so many women who are in their 30s and they're like going in and getting testosterone pellets, and it's like, well, why is your testosterone so low, when you're still fairly young, So that's the thing that I always encourage my clients to dive into is, well, what's upstream? Like what is causing the testosterone to be low or what's causing your estrogen to be low? If it's menopause, then obviously that's you can't change that. You're not going to all of a sudden start reproducing these hormones. However, there are things that you can do, and you want to make sure that all of the other stressors on your body are being addressed because all of those things can negatively impact your hormones as well. So always think about your body as a whole rather than just these little bitty pieces.
Absolutely. I know we're going to talk more about this, but with that whole topic of like, I mean, I was shocked. Like I haven't been in those circles of women in their 30s on testosterone. Like that blows my mind. So when you told me that,
Yeah,
it was like, who is giving these young women
right.
testosterone pellets instead of being a healthcare provider?
Well,
Like
and then
just because they're technically a healthcare provider giving you hormones doesn't mean they're looking out for your health, unfortunately. And
exactly.
that's a provider who is not looking out for their health.
Yeah. Well, and they're like, I had a friend who was getting testosterone pellets, and she's like, well, I feel so much better on it. I have sex drive again, and all these things. I'm like, that's great, but and so yeah, you may feel better, but you're not solving the issue. You're putting a
Mm-hmm.
band-aid on your symptoms.
Mm-hmm.
And if you continue to dig a little bit deeper and figure out, maybe your cortisol has been too high for a long time or
Yeah.
any of these other things that could be, suppressing the production of testosterone,
Yeah.
that matters. Look
It
up.
does. It does because let's say she's low in testosterone because her DHEA is bottomed out because you make
Hmm.
testosterone from DHEA. You need zinc to make testosterone. You need
Hmm.
sleep. So sleep is critical for
Yep.
testosterone. Now let's say she gets testosterone. Check. She's got her sex drive back. She's got the impacts of testosterone back. But let's say she continues to have poor sleep, low zinc, and low DHEA. What does that set you up for? A lot of issues.
Right.
Then it affects your digestion, it affects your blood sugar, it affects your immune function, your risk for breast cancer. Um, I mean, a number of things. So you're completely right. Like there's the reasons why you're low in testosterone, just because you get testosterone doesn't make those reasons go away, and it doesn't make all of those risk factors with those issues go away either, right?
Exactly.
So,
Exactly.
oh my goodness.
Joanna asks, which hormone test do we recommend? We're going to talk about that in a
Yeah,
little.
we'll talk about that in a minute. I will say that there's a lot of different ways to test hormones. I think there's pros and cons to every single way. And I don't think like I've heard some doctors say, "Oh, don't do this hormone test or don't do that hormone test or this one sucks." In my opinion, they are, I don't know if they're trying to say that to like be more popular or something, but in my book, it's like, well, any hormone test can be helpful if you're interpreting it correctly. The one caveat would be like if you're using cream hormones and you're trying to monitor what those levels are from the cream,
Hmm.
then that's the situation where you would want to monitor with saliva specifically because the cream goes to the tissues very well, very easily. And so it shows up in the saliva, but not necessarily in the blood. So some people have misinterpreted that and they check their hormones with their blood and they're like, oh my gosh, the cream is not doing anything for me. It's still really low. It's, but actually it's having a great impact, and typically the symptoms are improving. They just don't see that result in the blood. They need to check the saliva. So that's one situation where I think that's important. And we'll talk a little bit about the Dutch urine test and blood work and kind of the pros and cons on that. So, but I will say, just as kind of like a easy answer for you is, or anyone watching this, is if you're not sure, contact us,
Yeah.
tell us what the situation is, and then we can help guide you to the best testing for your situation. So if you're
Like every
not
answer.
sure,
It's
you
like
can always
every
talk to
answer for
us.
your health. It depends. It depends on what
I
you're trying to
know,
find
I
out.
know. So next I wanted to talk about estrogen and progesterone. We talked about the different types of hormones, the different delivery forms, but I wanted to make a key point here with estrogen because if someone is using synthetic estrogen, obviously there's risks with that. But even with bioidentical estrogen, there's still concern because estrogen is a growth hormone, it's a proliferative hormone, so and it affects your endometrium. So if you have a uterus, a womb, then you're going to have more risk for issues there if you're on estrogen alone. So progesterone helps to counteract and balance that effect in keeping your endometrium safe and healthy. So no matter what type of estrogen you're on, if your doctor puts you on estrogen alone, that's a little bit of a red flag for that healthcare provider, in my opinion. look for someone who knows the risks and dangers of that and is looking out for you and your safety and pairs it with progesterone. The other thing is knowing that progesterone by itself, in my opinion, is perfectly safe. Now, they have different effects on your health and your symptoms. So, for instance, estrogen is going to be typically more helpful for hot flashes, whereas progesterone is typically more helpful for mood, stress, sleep. So, they both kind of have like their areas that they impact more. So, um, like if you have hot flashes, you probably just, and again, this is very bio-individual, but just generally speaking, the estrogen would make an impact for the hot flashes, but you don't want to take just the estrogen. You do want to pair it with progesterone for safety reasons. But let's say that you have some menopausal symptoms and you want to just start with progesterone. I don't think you need to be worried about that as far as like the safety around it. It's more so the estrogen that can be a little bit more concerning on its own. So just wanted to make that clear. If you're wanting to dabble in hormones and you just want to start with one, don't start with just estrogen. You could start with just progesterone if that's an option for you or a good fit. A key thing that me and Ashley are so passionate about that we could probably talk all day long and scream it from the mountaintops is that hormones don't work in isolation. They're not, it's not like you put testosterone in the body and it just stays as testosterone. There's different processes happening in the body. And so, for instance, if we were to give a male client testosterone and he was overweight and inflamed and blood sugar issues and like that inflammation in his body can convert a lot of that testosterone to estrogen. So this is why we're really big on checking your hormones, monitoring the levels, and making sure that you're in a healthy place to use hormones safely, and that it's not backfiring on you. So inflammation, that's a big deal with testosterone, with estrogen. Estrogen's going to be more, I would call it volatile with a lot of inflammation going on. So this is why me and Ashley are so passionate about working on people's health first and foremost, and using hormones wisely and appropriately, and safely. So inflammation, insulin resistance, now that this maybe doesn't change the hormones super directly, it can with like your cortisol, and insulin resistance tends to increase testosterone going down a more problematic pathway of DHT, maybe some like more acne or hair issues going on with testosterone use. So insulin resistance is part of this, but it's also just a major disease risk factor, an inflammatory state of the body. And just because I'm kind of in that like breast cancer world a lot, I know how important insulin resistance issues are with breast cancer risk. We have that going on, and then we add hormones. It's like it makes me a little uncomfortable. So I would like, if someone's using transdermal low dose, being really minimal about the hormones, okay, but let's not overlook insulin resistance. Let's work on that as well to make sure you're set up for success long term. And then lifestyle choices like alcohol, not getting good sleep, smoking. I mean, those like oxidative stress, really damaging things in our lifestyle can definitely stress our liver and bring inflammation and breast cancer risk. So just some of those things to consider. And then last but certainly not least, liver and GI health is so important. Certain people have different genetics that might cause their liver pathways and detoxification pathways and methylation and things like that to be a little sluggish or not optimal necessarily. And so um, it's not it's not always something that you feel. That's the tricky thing is that a lot of people, they come to us and they're like, I think I feel fine, I'm struggling with this or that, but they don't think they have liver detox pathway issues. Like it's not something that you will feel. So that's why we like certain types of hormone tests, like the Dutch test that I'll show you in a second, because we get true insight on what's happening in the liver and how things are detoxing correctly or not. The other part of it is if you have certain nutrient deficiencies or excessive toxicity, bile recirculation going on back to the liver. If you have constipation or bacterial overgrowth, that can increase enzymes that cause you to reabsorb estrogen or reabsorb toxins, further stressing your liver. Whether you're taking oral hormones or not, your liver is involved with hormones, period. All hormones and xenoestrogens and plastics and everything. So we always want to look out for the liver and the GI health regardless, but especially if you're considering taking hormone therapy, especially. So the next slide here is just a little picture, little example of the Dutch hormone test that we like to run. Now, we don't have to do this test every time we check hormones, but the reason why I feel like it's critical for anyone considering hormone therapy is this section here where we're looking at your estrogens. We look to see at like which estrogens are elevated because there's different intensities around each type. So this is like your weaker type of estrogen. This is your strongest, most potent type. And so that gives us a little bit more in-depth information, but more importantly, we're looking at what's happening with that estrogen. So when we see this breakdown of the what pathways your estrogen is going down, that affects what really happens in the body from that estrogen. So let's say you get this test done and we see that your pie chart is mostly green. You have, kind of on the high end of the percentage range for this green one. This is the protective pathway, the 2OH, and that is beneficial for you. So that's what we want to see. This second one, the red one, this is more of a carcinogenic DNA damaging pathway that can increase breast cancer risk. And so if this is like on the high end or above that normal range, and I always like it to be as low as possible. There's really no benefit to this one. So I always like the goal is to be lower. And there's different natural things and herbal, nutrients and things that we can support the estrogen going down this protective pathway. But most people need to know, like, whether or not they need to go through all that trouble of like taking extra support for their liver and detox pathways. So this can give you motivation, like, okay, I do need to take this sulforaphane or this, DIM or calcium D-glucarate, whatever is the right form for you, because there's different options that have different impacts. And then this third pathway is the 16OH. And I always tell clients this is more of like your growth pathway of like cysts, fibroids, polyps, like nodules, and more. It is definitely associated with breast cancer as well. Maybe not as directly as the 4OH, but it's certainly a big breast cancer risk factor as well. So I like this one also kind of either in the middle or low end of the range and definitely dominating with the 2OH. So if we don't know this, if we're just, if women are just taking hormones, it has nothing to do with how much hormone you have. It's what's happening with the hormones. So you could get blood work done or you could get saliva testing done and they will tell you, oh yeah, your estrogen is perfect level. Great. Great, great, great. You're doing great. Let's not change the hormones. Everything's perfect. Well, what if your 4OH is like at 20% and your 16OH is at 30% or 40%, and this is all wacky here? That estrogen that you're taking or that you're producing is going down a carcinogenic or growth pathway that's going to hurt you, whether your estrogen is normal level or not. So that's why we really, really want to look at this information. And this is phase one. So this is step one of metabolism, and then it goes through methylation comped. And some people have some genetic issues with this that can slow it down. And so they need a little bit more nutrient and targeted support to support this pathway. So if this dial was on the left end and really low, even with this perfect pie chart, not that it's perfect, but near perfect, if this was on the low end, we would still be struggling with estrogen detoxification because of this slowing it down. So we want to see this going well. We want to see this going well. And then I always call phase three is, your bowel regularity, um, checking to make sure your gut is healthy and you're having regular bowel movements, because if all that slows down too, we'll still have some concerns there. So, but this is really key information for anyone considering hormones. And that's the Dutch test that we do. And then sometimes with clients who start cream or drops or whatever, it might be ideal to check with like a different hormone test depending on what hormones you're using from there. But I do really like this as kind of like your foundational testing before you start dabbling with hormones. Anything you wanted to add to that, Ashley?
I always tell my clients, your gut health matters when it comes to your hormones significantly. Like if you are not using the restroom every single day, you
Yeah.
probably have some sort of hormone issue because you cannot detox excess hormones if you're not pooping every day.
Yeah.
So that is a very important factor, and that's why we don't just look at one part of this.
Yeah. And one thing that I think is really important, I have a lot of women asking me with thermography, like, oh, I have all these breast cysts or I have these uterine fibroids, like, is it just genetic or like what's the reason? And I'm always wanting, I'm like, please consider doing a Dutch test. Let's see if the 16OH is elevated, because then we know it's coming from your estrogen. It's coming most likely with the 16OH. The most common reason this one is elevated is from GI inflammation. And that's why I'm always telling women when we go over their breast scans and stuff, like, hey, if we're seeing issues in the breast area, which is really sensitive to your hormones, we got to think about your liver. We've got to think about your gut, because most people don't feel gut issues unless they're really dramatic. Um, and they don't realize that's what's throwing off their hormones and their breast health and their cysts and their fibroids and all this stuff. So, um, yeah, a lot of pieces coming together with all that. And again, that's why we're always like, hormones are not in isolation. So it's very true. So this is what I would suggest for anyone considering hormone therapy. Get an overall health assessment. Make sure you're looking at your insulin levels, not just glucose, because glucose is kind of like up and down all day, every day. Get your fasting insulin and use I like to use the HOMA IR calculator to see like early assessment of insulin resistance. Look at your inflammatory levels, make sure that your gut is healthy. Like get someone in your corner who's going to look at your health from a functional medicine point of view and trying to get you to the optimal range instead of just that normal lab range. Because sadly, Western medicine, it's just disease care at this point. And with hormones, in my opinion, that's not good enough. That's not safe enough to just be out of the disease zone um, when considering hormones. We want to make sure you're healthy and going to use these hormones safely. Metabolism pathways, like we just talked about, you do want to get breast screening and pap smears and kind of like check on those areas, because they are very sensitive to hormones. So I'm not saying this to scare people, but it's just like checking your, P's and Q's and making sure you're not overlooking something or letting something get a little out of hand. Those are helpful to include for sure. And then monitoring the hormones, like some people just get on hormones and they're not checking their levels. I think Ideally every 3 to 4 months, but at least every 6 months, checking your hormones and not just looking at the levels, looking at the relationship between the hormones. Because I've had people come in, their estrogen is on the high end of the range and their progesterone's right at the bottom of the range. It's not so much that they're within range, it's how are they relating to each other and is something getting out of balance? So what we like to do, just to make it clear of like how we can help and what our role is and what it isn't, we don't do prescriptions. We can help, guide you and educate you towards using over-the-counter options like transdermal, low dose, safe options to start with. And we do care about symptom support. We're not just about your, root cause health issues. Like symptoms are real. They affect our lives. They affect our relationships. They affect how well we show up at work. They're a big deal. So I don't want to minimize the impact of dealing with menopausal symptoms or hormone symptoms. That's so important. And I do truly care about that aspect of it. But I don't want to support that by it while compromising on your health. So health is the number one thing. And then the quickest we can get the symptom support in place, the better if we do it safely. Obviously, we care about assessing your whole health while we're looking at all of this. We can't just look at hormones. That would just be, in my opinion, silly. Like, let's look at your thyroid. Let's look and see if your iron is low. There's so many things that can be causing those quote unquote hormone symptoms that maybe are not actually hormone issues. So we want to address all the pieces of the puzzle, and then we can start with things that are non-prescription. And if we work together, and obviously, like typically, we're making improvements across the board regardless, but sometimes just to get that final over the hump place in your health, like if you're in menopause and um, still struggle with a little bit of hot flashes or a little bit of insomnia or something, I have no problem with partnering with someone who does hormones the right way. We have a couple people that we've referred clients to where they're using hormones correctly. And so we're able to partner with that and kind of fill the gaps because typically most hormone providers, that's their specialty and they're not necessarily working on all the things. So that's where we come in, and we're happy to answer more questions. If anyone wants to reach out, this is our information. You can email us, you can call, you can message us in the group or comment on this video. But yeah, we're
We
here
did have a
for
question come
any
through.
support.
Um,
Oh, do we have some questions?
we have one. Would you recheck hormones with the Dutch test as well?
So it depends on what type of hormones we're using. Um, and it also depends on the purpose. So I like to use the Dutch when we're looking at your endogenous hormones that your body is producing on its own. But if you are using exogenous hormones like bioidentical hormones, external, taking that in supplementing, then it might be better to do the serum testing to see where your levels are at with those hormones added in. And then if it's the cream, you would want to do saliva testing.
And that's the only one
So,
we've had come up so far. So
okay. Well, I hope that was helpful. I mean, I'm sure there's a lot more that I could cover and discuss with hormones. It's a big topic. But I feel like this is a good amount of information to kind of process. And yeah, I'm glad that we did this topic. And then next week, Ashley will be doing her presentation with another health talk that I'll be sharing in the group shortly. So yeah, stay tuned.